This is Mr. Winslow. Mr. Winslow works for an insurance company. Most of his work is done from his home office, where he spends his time typing on the computer and answering phone calls from customers. Mr. Winslow's favorite pastime is singing and playing the guitar, which he does at least an hour a day. 2 weeks ago, Mr. Winslow started to feel pain, numbness, and tingling in his right hand and wrist. As time progressed, the pain started to get worse, affecting his ability to do his job and play the guitar. Mr. Winslow was referred to occupational therapy to receive treatment for carpal tunnel syndrome. So what is carpal tunnel syndrome? Carpal tunnel syndrome is a painful disorder of the wrist and hand due to compression of the median nerve between the carpal ligament and structures of the carpal tunnel. Symptoms may include numbness, tingling, and pain in the median nerve distribution of the hand and wrist. The patient may drop objects, feel cramping, and aching, especially during sleep and when driving. If the condition progresses further, or in severe cases, muscle atrophy and diminished strength of the thumb may occur. There are several factors that can increase your risk for carpal tunnel syndrome. Women are more likely to contract carpal tunnel syndrome than men. Patients between the ages of 40 to 60 and smokers are also at increased risk. Women who are pregnant, taking birth control pills, going through menopause, or taking estrogen supplements also are at increased risk. Health problems such as arthritis, diabetes, obesity, and hypothyroidism contributes to decreased blood flow to the wrist, which can increase your risk for carpal tunnel. Lastly, occupations that require repetitive use of the hands, such as typing, can also increase your risk. Carpal tunnel can result in decreased sensation in the thumb, first, second, and half of the third fingers, decreased range of motion, pain, and decreased participation in everyday activities. These areas are evaluated during the treatment session with the therapist. But first, the therapist will perform 3 tests to determine if the cause is carpal tunnel. In the Tinel's test, the therapist taps on the patient's wrist in the carpal tunnel region. The patient tests positive if pain is felt. In the Phalen's test, the patient bends both wrists downward with the backs of the hands touching. Pain means the test is positive. In reverse Phalen's, the patient bends the wrists up so that the palms are touching as if he were praying. Pain equals a positive test. Mr. Winslow tests positive for all tests, indicating that he does have carpal tunnel syndrome. To prevent aggravation of the nerve, keep the wrist in a neutral position. Avoid sustained pinching and gripping of objects. Avoid repetitive overuse of the hand. Avoid positioning the wrist in a bent position. Use tools with a built-up handle that contours to the arches of the hand, which relieves strain on the median nerve. Also, improving workplace ergonomics, such as body positioning, can help reduce strain on the nerve. Steroid injections may be given by a physician to decrease pain, or anti-inflammatory medication can be given through the skin by a therapist. Most likely, the patient will be given a wrist immobilization splint that prevents the wrist from overbending. Each patient will have their own schedule to wear the splint. However, the splint can be worn during the day and night and taken off for hygiene purposes and to perform exercises. Tendon and nerve gliding exercises help reduce pressure in the carpal tunnel, prevents nerve entrapment, and reduces pain. Exercises should not be painful. The patient should only stretch until tension is felt. Exercise programs are tailored to the patient. Mr. Winslow is instructed to perform his exercises 10 times each, 2 to 3 times a day. Strengthening exercises can be added with physician approval. For nerve gliding exercises, straighten the hand, then make a fist. Straighten the hand again, then bend the hand backward. Next, extend the thumb and then gently stretch the thumb without causing pain. For tendon gliding exercises, start with a straightened hand, then bend just the fingers to make a hook. Next, make a flat fist. And finally, make a full fist. Awkward posture, repetitive movements, and strain on the carpal tunnel in the workplace can exacerbate symptoms. Mr. Winslow sits at a desk typing most of the workday. Ways to improve his environment includes sitting in an upright position with both feet flat on the floor. His elbows and hips should be at approximately a 90-degree angle. He should also make sure his wrists are in a neutral position and not overbent while typing. If the condition worsens, the patient may be recommended for surgery. Carpal tunnel release surgery involves cutting the transverse carpal ligament to improve gliding between the nerve and tendons of the carpal tunnel area. Post-operative management would include splinting, pain management, and a home exercise program. After treatment, Mr. Winslow was able to improve function in his hand, allowing him to work and participate in his favorite pastimes. With proper treatment, carpal tunnel syndrome can be managed.